Hi everyone, my name is Brianna. I'm going to take a couple minutes to talk about my clinical experience this semester and how I was able to meet the clinical objectives within these experiences. I would have to say that clinical this semester definitely helped me grow as a person. I would say not only as a student, but also as a person. It really helped me understand what it means to be a leader and how to be a leader within different situations. For objective 1, I would say I was able to meet this objective in my peer leadership clinical. With this clinical, I was able to pull my knowledge of previous courses, especially my mental health course, to help when engaging with the students, and it helped me engage with them in a meaningful way. I was able to guide their discussions and talk about goals with them, while being aware of emotional dynamics and keeping the environment light yet respectful in the same way. I would also say I was able to meet this objective in my Skills USA clinical, where I relied on my previous knowledge of basic assessment skills to understand what each contestant needed to know. And I wouldn't say how to support them with it, but how to understand what they needed to do to qualify. It reminded me how important it is to have a solid foundation, and like stated in the article of leadership roles and management functions in nursing, it explains that strong leadership is built on applying past knowledge with confidence. And that's exactly what I was able to do with both of these clinical experiences. I would say objective 2, I was able to meet in my career pathways clinical while shadowing a midwife on a labor and delivery unit. This was one of my busiest environments, I would have to say. Watching her lead with a calm yet compassionate way was really inspiring. And she was able to take that and also make ethical decisions at the same time. She adjusted her approach for every patient to have a better relationship with them and coordinate with them and the care team for their stay. And this helped her be present and supportive with every patient. During this clinical, it really clicked for me that leadership isn't just about giving orders. I would say it's definitely about showing up for patients and the team while staying grounded in yourself and your values. This reminded me of the NA Code of Ethics, which talks about a nurse's responsibility to protect and advocate for patients while practicing with integrity. Objective 3, I would say, was met in a few places as well. The first place I was able to meet it was again in career pathways, which was during team huddles. I was able to sit in. Nurses, case managers, providers would be able to sit together and update each other on patients, what's going on with the patient, what's the care plan for the patient, and basically the overall goal for the unit and each patient. I would definitely say it looked a lot more simple to the surface, but what they were doing, incorporating patients with each other, definitely made a big difference. And it helped me realize how much good communication keeps patients safe and keeps teams connected. I would also say I'm at objective 3 at Daybreak. Talking to patients with really complex needs is what I mainly saw there and mainly did there. Some of the patients were struggling with housing, addiction, illnesses, and so forth. The way the staff communicated with clarity and empathy, and really showed how important it is to meet people where they are. Really made an impact on me. I would say it also tied in perfectly with the Journal of Nurse Management, which states how nurse-led communication improves outcome because it builds trust and respect and builds that relationship you want with your patients. Objective 4, I would say I met at the Holy Family Manor, where I saw how patient care is tailored depending on the floor and the level of need. Whether it was memory care or rehab, the care was always based on evidence and routine for them and how each patient could benefit from it. It really showed me how leadership and research can kind of go hand in hand. Another place I was able to meet Objective 3 was Camlot. It's not a hospital. It's a program for children with disabilities. And within this program, it provides them social, emotional development and activities that guide that development. It was a reminder for me that transformational leadership model is a very big thing, and this model is mentioned in the article of leadership roles and management functions in nursing. And this Camlot definitely encourages growth and empowerment of not only the kids, but definitely the staff there too. They make sure every activity they do with these students not only engages them, but helps them grow. Objective 5, I met at Daybreak, where I closely worked with the patients who often didn't have anyone else to speak for them except for the staffs. I helped them express their needs, and sometimes just being like a calm presence for them was really all they needed. Objective 6, I was able to meet through, I would say, a couple places. I would say Camlot, patient logistics, and peer leadership. I saw different styles of leadership within these clinicals. I would say that I realized that it was good to see that staying calm under pressure and being emotionally available to others was a very big thing in leadership. And these 3 clinicals definitely, in their own way, showed that. Clinical Objective 7, I would definitely say was another one I was able to meet with Daybreak. I saw how patients' access to services depended on policies. Some of them needed transportation, some of them qualified for housing, and others didn't. It wasn't always a fair situation for all of them. And it helped me understand how policy directly affects a patient. Healthcare policies can directly affect a patient, and why nurses need to be involved in these conversations and kind of let the patient know, but also advocate for them if needed. And the ANA Code of Ethic also emphasizes that we can't advocate for change if we don't understand how the system works itself. So educating ourselves in these policies and how the system can work in a way to benefit the patients and how it might not benefit the patients. Objective 8, I would say I met during my peer leadership clinical as well. I often had to be a voice between student and faculty just when it came to their simulation they had that day, which was wearing like a headset that showed a patient's room, and they had to have a scenario to de-escalate a patient. And you could see what the nursing students were seeing on their end through a computer, and it was just a little bit tricky at first, but having that advocacy of being a voice for them definitely helped the situation, figure it out, the bumps and the good things about it, the poor things about it, and whatnot. And this also reminded me of the ANA Code of Ethics, because being a good leader means consistently doing the right thing, even when no one's watching. But looking back on all of it, I was definitely really thankful for all these experiences and how I was able to meet these objectives. I was also able to, in these clinicals, go to Harrisburg, which I really liked. It definitely opened up my eyes to the political side of nursing and how advocating on that end could be very helpful, and being a leader to nurses through the political side can be very helpful in shaping nursing. I would also say my least favorite experience would probably have to be Daybreak, only because it was fun to be an advocate for these patients, and to see what this facility was able to do for them. But I felt as a nursing student, it probably just wasn't the best location. I definitely had better experiences at the other clinicals. But overall, I had a very good time seeing different sides of leadership within clinical this semester. And it definitely helped me learn and shape me to be a better nurse, for sure. And I'm excited to see what else is to come. So thank you.